So palpitations describes an awareness of the heart beating, and this can happen in the context of a completely normal heart rhythm, or it can occur in the context of a change in the heart rhythm, an abnormal heart rhythm. As electrophysiologists, one of our main jobs is to identify exactly what the heart rhythm is doing at the time of those symptoms. Now, there are certain characteristics of palpitations that may make an abnormal heart rhythm somewhat more likely. So, for instance, symptoms that come on very suddenly, symptoms that feel very irregular, symptoms of palpitations that go with lightheadedness or collapse even, or that go with a change in your exercise capacity or an increase in difficulty breathing, for instance. These features might make us slightly more concerned that there's an abnormal heart rhythm responsible for those symptoms of palpitations. But a really important message is that we can only be absolutely certain what the cause, the heart rhythm cause of symptoms of palpitations is when we've actually identified a heart rhythm recording at the time of those symptoms. And so working to acquire that, working to get that data is something that we often work together with patients to do, so we can make that precise diagnosis. So atrial fibrillation is a heart rhythm disorder which exists in the top two chambers of the heart. So whenever I think about atrial fibrillation, first I find it helpful to think about what the heart rhythm does in health. And every heartbeat in health arises from the top chamber of the heart on the right, which gives out an impulse, an electrical signal once every second or so, that then spreads in a organized manner through both top chambers of the heart before sending a signal through a single electrical cable down to the bottom or main pumping chambers of the heart. Now, in atrial fibrillation, that coordinated electrical activity in the top chambers of the heart is lost, and instead of a regular pattern of activation, what we see completely chaotic electrical signals which are very rapid and whiz around those top chambers of the heart in a very unpredictable way. Now, that has a couple of consequences. First of all, those top chambers of the heart stop contracting, and second of all, there's the signals arriving at that main electrical cable between the top and bottom chambers of the heart are very rapid and they're irregular. Now, that can result in an increased stasis or pooling of blood in the top chambers of the heart, which is one of the contributors to an increased risk of stroke that we know goes with this condition. Now, in addition, the rapid and irregular electrical signals that are arriving at that main electrical cable mean the heart can be very rapid and can also beat irregularly, which can contribute to those symptoms of palpitations as well as difficulty breathing that frequently go with atrial fibrillation. So palpitations are a very common symptom, and really as electrophysiologists, one of the most important things we do is try to work out what the heart rhythm is doing at the time of symptoms of palpitations. Now, there are a couple of characteristic features of palpitations that we much more commonly see in patients with atrial fibrillation. Now, that includes palpitations that come on very suddenly and are associated with a feeling of the heart beating very irregularly. Now, these things can point us towards a diagnosis of atrial fibrillation, as can the presence of certain risk factors, so certain other cardiovascular conditions which we know are associated with atrial fibrillation. So, for instance, if you're known to have heart valve disease or high blood pressure or coronary disease or another condition called obstructive sleep apnea, these make the presence of atrial fibrillation more likely, particularly when patients develop symptoms of palpitations. But as is common to all of our work in electrophysiology, the only way we can be absolutely certain is when we get a heart rhythm recording at the time of those symptoms, which will allow us to make what we call a definitive diagnosis. So we can say to a patient, this is what the cause of your symptoms is. So there's a number of treatment options for atrial fibrillation. Perhaps the most important first thing that we do in all patients with atrial fibrillation is we make an assessment of the risk of stroke that goes with this condition. And this will allow us to make a judgment about whether or not we suggest that the patient takes a treatment to reduce that risk of stroke. And the mainstay of such treatments is the use of blood thinners, for which we have a range of different drugs available now, which can very effectively reduce that risk of stroke that goes with atrial fibrillation. Now, the second aspect of treating atrial fibrillation is treating the heart rhythm disorder itself. And this is usually aimed at preventing or reducing the chance of episodes of atrial fibrillation and reducing the duration of those episodes of atrial fibrillation as well. And the options we have would include drugs or ablation procedures, and finally, in a small group of patients, pacemakers as well. Now, an ablation procedure is a way of trying to identify the bits of tissue that we think are responsible for setting off, and in some cases sustaining the atrial fibrillation, and delivering some kind of treatment to try to eliminate those bits of tissue, and that can be cauterization or sometimes freezing, and in some cases a range of different technologies, but all designed at trying to eliminate those bits of tissue which set off and maintain those episodes of atrial fibrillation. This is such an important question because atrial fibrillation is increasing, and the number of people in the UK who suffer with atrial fibrillation has increased very dramatically over the last 20 years and is expected to continue to do so. So it's important that we are all mindful of things we can do to reduce the chance of us developing this condition in the future. Now, there are a number of conditions which we know are associated with atrial fibrillation, something called obstructive sleep apnea, high blood pressure, and treatment of these things we know can reduce the patient's chance of developing atrial fibrillation in the future. Now, in addition, maintaining a healthy weight, healthy levels of exercise, as well as not drinking alcohol to excess or using recreational drugs, these are other lifestyle choices we can make, which we know will significantly reduce the chance of developing atrial fibrillation in the future, and also have the additional benefits of being good for our overall cardiovascular health in the future as well. Now, despite these, there is a group of patients who still go on to develop atrial fibrillation, and the good news is we do increasingly have some very effective treatments that we can offer these patients, even if the atrial fibrillation does begin to cause them problems, regardless of these management of these other conditions. The identification of atrial fibrillation is a really critical aspect for us as electrophysiologists, because we know that when it goes untreated, it can be associated with a series of complications. Perhaps most concerningly is the risk of stroke that goes with atrial fibrillation. And if we don't know that a patient has atrial fibrillation, then we cannot implement the treatment options that reduce that risk of stroke. Now, unfortunately, we know that strokes associated with atrial fibrillation are both more severe and have a higher mortality than strokes which are due to other causes. And so that's a really critical thing that we want to identify and reduce the risk of in patients with atrial fibrillation. Now, the other complications that can arise from untreated atrial fibrillation is the development of long-standing episodes of atrial fibrillation, which can be much more difficult to reverse and get patients back into a normal rhythm, and also the development of heart muscle pump function, which can occur in the context of prolonged episodes of atrial fibrillation, and in some cases even the development of heart failure. With atrial fibrillation, we know that our treatments are most effective if they're delivered earlier in the disease course, and therefore that really motivates us to identify this condition as early as possible, so we can work with patients to identify the most appropriate treatment for them at a point in their disease process when we have as many options available to us as possible.